A very good morning to everyone. So my topic today is pupil size in migraine with photophobia versus normal subjects and photochromatic glasses role in migraine. So as you know, migraine is the third most common disease in the world and almost 1 in 7 people are affected worldwide. It has a core component of photophobia in 80% of the cases, and in one-third of the migraine patients, bright light is the triggering factor. So why does photophobia happen in migraine? There are many theories like cortical hypersensitivity to light, altered ocular parasympathetic outflow, intrinsically photosensitive retinal ganglion cell, but we wanted to study what is the role of the pupil size in migraine. So our the purpose was to compare the pupil size of patients having migraine with photophobia versus normal subjects and to evaluate the role of photochromatic glasses in reducing the MIDAS, that is the migraine disability assessment scores. It was a prospective case control study. 100 eyes of 50 patients with migraine were compared with the same number of normal subjects in the age group of 20 to 30 years with a male to female ratio of 40:60. The visual acuity was 6 by 6 without any significant refractive error. There was normal anterior posterior segment evaluation. Patients did not have any neurological conditions or trauma, and they were not on any medications or eye drops. It was a single observer who measured the pupil size with the help of IL-Master 700. Undilated photopic pupil size measurements under similar light settings were done in both cases and controls. MIDAS scores were obtained in all cases before and 3 months after prescription of the photochromatic glasses. So coming to the results, we found that the mean pupil size in patients with migraine and photophobia was 4.89 millimeters as compared to the normal subjects who had a mean pupil size of 3.8 millimeters. Now, coming to the grades of MIDAS severity, we found that patients who had grade 4 MIDAS or the most severe type of disability had the largest amount of the mean photopic pupil size, that was 5.6 millimeters. Now, in this study, we have not included any patients with physiological we have not included any patients who have had anisocoria. So, all the patients were having physiological anisocoria within 0.4 millimeter difference between the two eyes. And but in amongst them, we found that in 80% of the cases, the larger pupil size correlated with the side of the headache. Now, the effect of photochromatic glasses in migraine patients, all the patients who took photochromatic glasses, we found that 90% of them had a reduction in their MIDAS scores, whereas 10% had no change in their MIDAS scores. So this is the first study comparing the pupil size of migraine patients with normal subjects. According to the MIDAS scores, we have seen that the pupil size in the patients who have a MIDAS score of 4 has been the largest. There have been few other studies where transient unilateral mydriasis or AD's pupil has been reported, and this has been linked to the dysfunction of the autonomic nervous system. But this study shows that maybe an intrinsically larger pupil size could be a trigger factor for migraine. There have been studies where use of tinted glasses like rose K and blue light filters have been used in migraine because it has been seen that certain wavelengths of light, for example blue and red, they trigger migraine attacks more frequently, whereas green light has been seen to be more soothing. But in our patients, because sunlight was the main factor involved, we have used photochromatic gray glasses, and this has helped to reduce the MIDAS score significantly. So conclusion of this study is that the pupil size in patients of migraine with photophobia is larger as compared to the normal subjects, and this could be a trigger for the migraine attacks. And photochromatic glasses can help reduce MIDAS scores in migraine patients and can be a potential method of treatment in such cases. Thank you.
You use the IOL master to measure the pupil size.
Yes, ma'am.
I think infrared pupillometry is a more scientific way of measuring the pupil size.
Yes, ma'am. Actually, we didn't
Because,
have an infrared pupillometry, and
okay,
we also found a study which has been done by Shi and Yuan, which says that infrared pupillometry, as compared to IL Master, has seen to have almost similar pupil sizes in both. So, considering that, we had the IL Master 700, and we were seeing that there is a difference in the pupil size, so we did the study with this. But
I don't know, scientific literature says infrared pupillometry is
yes,
the
ma'am. Yes, ma'am.
superior to this.
Yes, ma'am. Definitely.
Okay, otherwise, nice study.
Excellent one, good. But I want to know on regarding that, whatever as Madam told, infrared is main. But if you are comparable, only you can control the room light.
Yes.
That is for IOL master is easily available in every setup nowadays. So in such scenario, what is your recommendation to the others to room light adjustment?
The where we had measured, it has just an ambient room light setting, because we wanted to see that whether actually this idea for this study came from a patient who had started to develop migraine attacks after a traumatic AD's pupil. So the patient had never had any attacks prior to this, but we found that when we gave diluted pilocarpine, the migraine, the MIDAS scores completely went from MIDAS 4 to MIDAS 1. So the patient was able to go out in the sunlight, and so just we had an idea that whether their pupil size has any correlation, which might be a trigger factor to cause the headache. So that is why we went for this study, and we found that actually there is a correlation. That means that only those patients who are having a very higher amount of disability which are in the grade 4 category, but definitely having a size
Yes,
which was
fine,
larger.
fine. That I want to know that you can just tell to technician basically
Okay, okay.
the amount of light and
Light.
what and the type of the light.
Type of
Then it will be neutral for all.
Neutral
Then
for
you can for your correlating.
correlate.
So on that particular room, the same amount,
Of
same light should be in all the patients.
all the patients.
Then you
Yes,
can.
that's
Okay, fine.